I'm Jamie. I'll be talking to you today about hypoglycemia, which is low levels of blood glucose. The causes of this are over-medication with insulin, the use of beta blockers, the use of alcohol, missed meals, adrenal deficiencies, severe infection, kidney failure, liver failure, delayed insulin release, which is your body not producing insulin when you eat, but 4 to 6 hours later after your food is already digested. Genetic defects in the regulation of insulin, such as your body just doesn't release the insulin it's supposed to, partly because your parents had it. It could be a gland that was abnormal when you were born. You could also have an insulin-producing tumor, which means your body produces too much insulin because of the tumor, which brings your blood sugar down. A pituitary gland problem. This is especially for small children and preteen children. Their pituitary gland regulates their growth hormones. Their growth hormones supply glucose. And if they have a pituitary gland problem, then they're not producing the hormones that they need, and this causes their blood glucose to go down because their body does not have enough glucose to keep their growth hormones up and their body produced with sugars that it needs. The effects of hypoglycemia are shakiness, dizziness, weakness, fatigue, lethargy, double vision, clammy skin, fast irregular heartbeat, anxiety, difficulty thinking, confusion, headaches, seizures, coma. If a patient with a hypoglycemic coma does not get the required medication or injections that they need to come out of the coma or to bring their blood sugar back to normal, it can ultimately result in death. There have been a few cases known of hypoglycemic death in the United States. There's also slurred speech and paralysis. I have suffered with hypoglycemia for 10 years now. I was 16. They removed my gallbladder. I found out a couple months later that I had hypoglycemia. I woke up every morning with nausea, vomiting, dizziness, headaches. I had personality changes. I was fatigued very easily. I had difficulty speaking, impaired judgment. I was dizzy a lot of the times. How they treat this, first they do the self-glucose exams, which is done by these little meters. You take the little pin out and you poke your finger. You stick the strip in here and it gives you the reading of your blood glucose. Under 55 is low, very low. Over 120 is very high. So the normal range is between 55 and 120. You can also have glucose pills, which is just a little glucose tablet that you stick in your mouth, chew up. 5 to 10 minutes, your body should be back to normal. They can also inject glucose or glucogen. Glucogen is just another form of glucose. The injections, however, are done by doctors. You cannot give yourself one of those. They also may change your meal frequency. Say if you eat 3 times a day, they might change it to 5, 6, 7 times a day. You need to eat small meals and stuff that will produce the glucose for you if you're not producing enough. In severe cases, they have been known to remove the pancreas. The pancreas produces insulin, and if you have a pancreatic tumor or problem with your pancreas where it's overproducing insulin, they may go in and remove your pancreas to keep you from being hypoglycemic and to renew your body with the glucose that it needs. Other than that, they've also got out chewable tablets now. They've got out like little gummies that you can chew for treatment. They have medications out now that help in moderate to severe cases, though. They usually treat them with injections. They usually stay away from the over-the-counter glucose pills and things like that. They usually go right to either trying to figure out if you've got a kidney tumor or liver failure, severe infection. They look to those things first if you've got mild to moderate or moderate to severe hypoglycemia. They'll look to that first. Diabetics also have been known to have hypoglycemia due to their insulin injections. If they overdo one, they have hypoglycemia. But most of the time, moderate to severe, they will go straight into surgery or a number of tests to find out exactly what is causing this.